everyone, I'm Leslie Cornwell, certified nurse and midwife with Empowering Midwifery Education. This section has to do with staffing options for your home birth practice. A legal disclaimer we put at the beginning of all of our presentations. This information is for general and educational use only, not intended to substitute for professional, clinical, or legal advice. We strive to keep our information as accurate as timely as possible, but make no promises and guarantees that it is pertinent to your unique situation. Course objectives, we want to go to the basics of what is exactly staffing, what is the importance of understanding your staffing and their different roles and responsibilities within your home birth practice. You want to talk about the different ways to strategically plan for having staff joining your team. Who do you need to do first? What is the different ways to recruit, the different type of staffing roles, and how you're going to utilize your team so that everybody supports each other. So why is this important? The make or break of a midwife's practice, safety, customer service, burnout has to do with the team she surrounds herself by. So as a midwife, it's really important to hire high quality staff members, have clear responsibilities, roles, duties that they each are expected to do, good, clear training processes, chain of commands, policies and procedures that they can reference to look for things to clarify how the flow of the home birth practice wants to do a certain task or duty. So it's really important to hire people well qualified, clear job descriptions. They have a clear understanding of the short-term, long-term goals of where the practice wants to go. They have good moral ethics. They're hard workers. They have great reviews from prior jobs they did, the experience, the skills of what you're looking for each of those roles within the home birth practice. You want to have a clear understanding. Do you want to stay a solo one-woman shop for your practice long term, or do you eventually want to start out as one midwife, but you're going to have 3 to 5 midwives, more of a co-op, multiple radiuses, eventually go into a birth center? You want to understand a good sense, because as you're interviewing people, you want people to come on that love your mission and your vision and where you want to go so that they'll be with you long term. So there's different staffing activities people can do. You want to be very clear of their role, their duties, their cross-training responsibility, because it's a small practice, that your office manager is going to know pretty much every single person's job description. If they don't show up, they quit, and you need to hire somebody, those roles need to still be filled. So it's really important that you have designated roles and responsibilities for each person, but then have cross-training and have multiple exit strategies and what if scenarios figured out of who's going to help with what. If you get busy all of a sudden, you've got a bunch of births. Our office manager, our receptionist, our doulas, our childbirth educators were all birth assistants. We would really cross-train and have a support, because when you've got a small volume home birth practice, 3 to 5 births a month, it's a lot to ask one person to be on call 24/7 as your birth assistant, but you can ask your team and staff to rotate that responsibility. So selecting the right people, especially from the beginning, because it's a ripple effect of their attitude, their mindset, their work ethics, their ability to be leaders will affect the rest of your team for years to come. And the culture and the way that they talk on the phone to the clients, the way they educate, the way that they empower, the way that they really devote into being a birth assistant and looking at evidence and being really skilled to help with emergency situations. Those are things that are important to have good training modules, have good expectations of quality with the people that you're looking to hire. You want to make sure you have good, especially those full-time on-site long-term W-2 employees. You want to have evaluations, you want to have performance, you want to have disciplinary steps of if there's concerns, they're not meeting benchmarks you have in place, being very objective and accountable both directions on these things for activities and roles you want each person to play. So the different responsibilities of your staff, it's going to vary greatly based on how big you want to be, what are your budgets, how many clients you want to take, what's the service radius you want your home birth practice to have. But there are very key people you're going to want to have on your team from day one that are essential for safe quality care. Are you going to have a clinic? Are you going to do all home visits? Are you going to have a home office that they come to? These are things that you want to think about, because if you're doing all home visits or you're doing a home-based office, most of your staff is going to be working remotely. You may or may not have a receptionist that's on site that the clients see. You're going to have more of them answering the phone and navigating, scheduling people, answering questions. If people are curious, want to set up a consult, they have questions about the practice, your front line, having somebody that can answer the phone is really, really important from Monday through Friday, 8 to 5, even if you're a small practice, because when they find out they're pregnant and they don't get a hold of someone, they're going to go down the list and call other midwives, and they're going to probably pick whoever talks to them first, whoever is warm and bubbly, they connect with. And so you could be losing a lot of potential clients that are awesome and amazing purely because you didn't have that person answering the phone and more available. So maybe in a home birth practice, your office manager is going to work in the clinic, they're going to work from home, they're going to answer the phones during the designated times you have, they're going to have multiple roles and responsibilities. A home birth practice does have less staff than a birth center in a women's health clinic, but it's still really important for you to have these people because it's unrealistic for a midwife to do everything. You need a birth assistant, you need an office manager that can be your receptionist, you need to connect with doulas, childbirth educators, lactation consultants, whether they're on your own staff or you refer out to them. They are still either independent contractors or just referral programs you create in the community. So you want to create this team around you, whether you're hiring them directly, you're independent contracting, you're outsourcing their company for your marketing, for your billing. There's really important key people to consider when you're starting your birth practice. You want to utilize the best of abilities of each person. You want to find their passion, their skills, and what they want to learn about, because it's going to show in the care that they offer and what they're going to bring for value to the team. So you're going to want to be very strategic with who do I need in the beginning. So I always encourage a home birth practice. It takes 2 to 4 months of good planning to get a home birth practice going, as long as you have the license in the area. You've got a lot of things planned and established to get going. You're going to want an office manager that hybrids as your receptionist. You're going to want a birth assistant that's willing to be on call more for you. Maybe it's a midwife student, or you're going to have a pool of 3 to 5 birth assistants you train, and then you make a call schedule. They're going to rotate throughout the month and support the call coverage. Are you going to accept late transfers where you're going to start births right away, which makes the most sense because then your revenue stream, versus you're going to accept most clients at 10, 12 weeks gestation. You're not going to see much money coming in until towards the end of the pregnancy and delivery, depending on how you set up your fee schedule. So these are things to think about. You want to get a great marketing campaign going from the beginning. You want to get as many consults, inquiries, your ideal clients calling your practice as soon as the doors open. So you want to have people that are hard workers, they're passionate about what you're doing, their morale, their work ethics, their respectfulness is there, because those are huge things as you continue to grow. These are the leaders for, if you want a team, if you want 3 to 5 midwives, you want a co-op, you want to expand into a birth center, the people you hire at the beginning are going to be the leaders for your future staffing. So there's different steps to think about while you're hiring staff. You want to look at your business plan, you want to look at the services, you want to look at what your budgets are from day one and where you're going to go, and how much manpower, what do you need at the very beginning to run successfully? Because I see too many midwives say, well, I'll just do that, I'll do that. I'll do the landscaping, I'll do the snow plowing, I'll order my own supplies, I'll answer the phone calls, I will set up the new intake paperwork, I will follow up on the labs, I will order the ultrasound. The list goes on and on and on. And then the midwives are wondering, while they're burnt out in 2 to 3 years of their practice opening, and they're working 100, 120 hours a week, and they're not getting a good work-life balance because they decided from the beginning to take on all these other team job descriptions and roles that really should be outsourced. The most important role for the midwife is to be the business owner, make sure that the strategic plan and implementation is happening for the practice, and taking care of the clients. That is their most important role. You want to have an office manager, a receptionist. You want to have someone that can recruit high quality people and train high quality people. You want marketers, billers, a medical assistant, a birth assistant, a nurse, a childbirth educator, a doula, depending on what services you want to offer in-house versus you want to refer out. But you want to pick people. You want to know, okay, from day one, I want an office manager that's going to hybrid to my receptionist, and we're going to hire 3 to 5 resource independent contract birth assistants. 6 months to a year, I'm going to hire another staff. We're going to get somebody on that is doing receptionist, and they're doing operations, quality improvements. We're really taking it to the next level. So you have to think about those things. You have to think about the step-by-step. Who do you want on from the beginning? How much does it cost for each person to bring on to the team? What is the average going rate for a receptionist, an office manager, a birth assistant, a midwife if you want to add another one to the team? Who should be given full-time benefits and who's an independent contractor or part-time? You want to be able to transition people easily in the beginning, that they have cross-training. Because you're a small place, you want to stress that you're going to have multiple roles in the beginning, but as our team grows, you're going to get more specialized, and we can transfer you into different roles and promotional leadership positions. And so you really want to get high quality caliber people on your team. So there's different types of employment statuses. We have a more discussion in details further in this course about it, but I just want you to understand there's many different ways to hire staff. You can hire them on site with you, working side by side while the clinic is open. They could be birth assistants on call. You can have remote workers that can answer the phone from home. You can have a virtual assistant from anywhere in the world. You could have a marketer or a biller that's a company you outsource, that they work on site or in their home or clinic setting. So there's a lot of different people you can hire. They could be W-2s, they could be 1099. You could just outsource to a company to support things. You just have to really think about what kind of setting are you doing. All home visits? Do you have a clinic? Do you have office space in your clinic that they can be on site? It is nicer if you can have your team more on site, but maybe they'll take less money because you're letting them work flexible and they don't have to spend the gas and drive in. That has value. So when you're thinking of hiring people and negotiating, don't just think about the money. Think about you're giving them that good work-life balance where they can work while their kids are in school, and if their kids are sick, they're specifically doing marketing projects, things that are a little more flexible that they can work on, claim processing when the kids go to sleep. They can work on some social media campaigns and some things to outreach on more flexible timelines. So those are things you have to know ahead of time, what you want from that person in the role, what structure, what are the hours. Do you want someone on 40 hours a week? Do you want someone 20 hours a week? Do you want them just doing per diem filling in for birth assisting? So you have to really have a clear expectation of each person's role, short-term and long-term, on your team. So the different staffing options for a home birth practice, it varies greatly. You can be Amish, doing home visits, just have birth assistants, doing your own thing, low key, small, simple. That's one variation, but you still have staff. You can have large scale. You can have a clinic, you can have multiple midwives, you can do home visits and home births and have a receptionist, an office manager, biller, because you're doing insurance. There's wide variations of how you can structure your home birth practice. So obviously for a home birth practice, you need a midwife. It's very difficult to take care of patients and do prenatal visits and births without a midwife, whether that's you or it's a team, or you're being more the business owner and you're going to be working resource part-time, but you're going to have a full-time midwife on staff that's going to be the branding and reputation of the company. So you have to think about these things. The midwife is the one that's going to do prenatal, birth, postpartum, newborn care, the first month of life. It's really nice if you can get somebody with experience and out of hospital and water births, but it's hard nowadays. Most of the midwives are going to hire, they're either going to train the midwife that's a student and they're going to join the team, or they're going to hire a new grad and have to invest the time in training them in their unique setting and practice and clientele that they're serving. Midwives can do hospital, birth center, home. Your practice could initially be home and then you get hospital privileges in time. You could buy a building and do a birth center in time. So they're independent care providers and low-risk healthy women, but you have to have collaborating relationships in place with physicians, the medical community, referral basis within your services that you're going to offer. So if all of a sudden you're planning, well, I'm just going to do OB care, I don't want to do any primary care, who are you going to follow up to have them do contraception and have them do annual exams? If you notice an abnormal mole on their back, who's the dermatologist you're going to refer to in the community to get them taken care of and well established? There's there's something abnormal on the ultrasound and you need to consult a physician, who's the obstetrician, who's the family practice physician that has OB services, you're going to connect with and talk to. These are important relationships, even if you don't hire them, for the success and safety of your practice, short-term and long-term. So obviously you want a birth assistant, midwife assistant. If you're not going to have a birth for 3 months, spend some time training, spend some time having them help you in the office, getting projects, getting to know your clients, and building up that relationship and skills. But if you're going to do births right away from day one, you want to have a call schedule, a pool. Once in a while you can get one midwife student, someone that's a birth assistant that wants to be on call 24/7, but that's very difficult. Most midwives get a pool of 3 to 5 birth assistants, whether you're small scale or large scale, and you have a Google Drive doc, and they share call, you train them, you do drills together quarterly, you have basic continuing education requirements, they have NRP, they have CPR, they have drills and things that are expected, so when the emergency situation happens, you have that second person to help with mom and baby during the birth in the home setting. It's nice to have birth assistants in multiple parts of your home birth service radius. We would have a primary person on call and a secondary person on call, and we would try to make sure that they're in different radius corners of our service area, because what if two people go into labor first at once and they're opposite ends of your radius? It's nice to pull the birth assistant that's closer to that mom than the one that's on the opposite side of your home birth service radius. So another important thing is a receptionist. Your office manager can fill that role, but you want to have somebody available Monday through Friday, 8 to 5, 9 to 5, answer phones, because I stress it over and over again to midwives. Like, if they go to voicemail and they don't get responses for days and days, it's the impression with your home birth practice that you're too busy for me, I've already picked somebody else. They're gonna, when they find out they're pregnant and not established anywhere, they're gonna pick the person that answers them the fastest, they get a good connection relationship with, they're going to schedule their consult, and they won't even worry about calling you back. So if you don't want to pay all this money for marketing and then lose potential clients, you need to have a person that can answer the phone as much as possible. A receptionist should be your warmest and friendliest person on your team. They are the first impression, good or bad, of your image, of your practice, the quality, the competencies, the friendliness, compassion. They have multiple roles. They're going to answer phones. They're going to help sort through labs. They're going to triage, does this person need to talk to the midwife right away? Can it go to voicemail? Should I just text the midwife and tell them she'll call back in 30 minutes? Like, they have to have some basic understanding of medical things to help navigate, is this an urgent situation or can this wait? And so there's a lot of things they handle with daily scheduling, registering paperwork. If you have a clinic on site, they're going to help a lot in that waiting room area with clients and their questions they have. An office manager is a really, really important person. In a home birth practice, the office manager receptionist tends to be a dual role, and that's okay. But an office manager in any midwifery practice is vital, vital, vital. They help with expanding, improving operations, training people, hiring people. They're the personal assistant to the midwife, the business owner, to make sure the day-to-day operations run well. They can do the inventory follow-up, they can do quality, they can train people, they can make sure that the finances are meeting quotas of what you're looking for claim processing, balances are being paid, inquiries, services that are being offered. The marketer is on the same page of the branding, the reputation, and what type of clients and where you guys want to go the next 3 to 6 months. So the office manager is really, really important. You want to hire a highly skilled multitasker, leadership, professional, respectful, conflict resolution. This person has a really, really important role in your home birth practice. I would say it's second rate to the midwife. A medical biller, it just depends on if you're cash. You may just collect the office manager, receptionist may just collect the money and not need a biller. But if you're doing insurance, you could outsource this. You could have somebody on site. I would say most home birth practices, if they're billing out of network for insurance purposes, they will outsource this to a billing company and pay a commission rate. But if you're really high volume and you've got multiple midwives and you're growing and you're going to start a birth center, it may make sense to have a part-time, full-time biller remotely working on site in-house. They're going to process claims, they're going to send out patient balances, they're going to have the conversations of estimated cost of responsibility for services, they're going to send people to collections if they're not paying. They're going to be a very vital part of your practice because they're the make or break of the finances. If the money's not coming in and people aren't paying their bills, following up on payment plans, you have a cash upfront discount and they don't pay, they have to be converted to another financial program. So the medical biller is the financial blood of the success of the practice. The marketer is really, really important. I'd say a lot of home birth practices just outsource this, or they train their receptionist, office manager, or birth assistant to do this role and responsibility on their team. You're going to want them to do a lot with social media. You're going to want them to network and get your name out there in different parts of the community, make flyers, brochures, create open houses to meet the midwife. You're going to want to connect with chiropractors, naturopaths, doulas, people in the community that are like-minded to the services and the philosophy of the home birth practice. So you have people to refer to, plus they will refer people to you. So a marketer is really, really important because you could have the best practice in the world, but if nobody knows you exist, it does not matter. So I'm going to stress it to you. As a marketer, they have a very, very vital job. They're going to make or break how many phone calls you get, the type of phone calls you get, the services you want to offer, the branding, the reputation, the image to the community of your professionalism is from your marketing campaign. So if you do not have a good, strong marketer on your team, you're going to lose a lot of potential clients that you don't even realize. So just to summarize this, it's really important to think about all the different staff on your team. You can have a small, simple home birth practice and just a virtual assistant, an office manager, receptionist that works from home, and then a pool of birth assistants. You can be very simple, low key, but you still have to have people on your team you've trained, they're qualified, and they're competent to do their roles and responsibilities. You could say, okay, I want 3 to 5 midwives, I'm going to grow, I'm going to expand, we've got multiple clinics, we're going to eventually open a birth center. You're going to need a lot more staff. You're going to need office managers, billers, marketers, additional practitioners on the team. You're going to need very important roles to be highly skilled and trained and have clear policies, protocols, guidelines that they can reference so they can do their jobs well. So I really want to stress to you, think about from day one, not the midwife doing everything, but how can I make my budgets? How can I make my fee schedules accurate so that I have these key roles filled to help me be successful, help me not work 100, 120 hours a week, help get these experts around the community that are far better at marketing and billing in handling the day-to-day operations of the practice so that we can be the midwives, we can be the business owners, we can be the foundation of looking at all these different operations to improve the practice's quality, image, and safety standards to continue to grow long-term.